If you've used a modern tracker, you've seen the fancier metrics, a readiness score in the morning, a recovery percentage, something called heart rate variability. These have become the flagship features of devices like Whoop and Oura, promising to tell you when to push hard and when to rest. But what do they actually mean? What is heart rate variability, why do athletes obsess over it, and can a wristband really tell you how recovered you are? Let's decode heart rate, HRV, and the science of recovery, the real signal, and the hype around it. Let's start with the simplest metric, because it's also one of the most genuinely useful, your resting heart rate. It's just how many times your heart beats per minute when you're completely at rest. And unlike calorie estimates, wearables measure this one quite well. Why does it matter? 2 reasons. First, as a fitness marker, a lower resting heart rate generally reflects a stronger, more efficient heart, and as you get fitter over months, you can often watch your resting rate drift down. Second, and maybe more usefully, as an early warning signal. A sudden jump in your resting heart rate, say, 5 or 10 beats above your normal, is often your body flagging that something's up, you're getting sick, you're stressed, you drank too much, or you're overtrained and need rest. Many people have caught an oncoming illness a day early just by noticing their resting heart rate had spiked overnight. It's a simple number with real signal. Now for the metric everyone talks about but few understand, heart rate variability, or HRV. Here's the counterintuitive idea. Your heart doesn't beat like a perfect metronome. Even at a steady 60 beats a minute, the exact time between each beat varies slightly, a few milliseconds here and there. HRV measures that variation. And here's the surprising part, more variability is generally better. A high HRV means your nervous system is relaxed, balanced, and adaptable, your body's rest and recover mode is working well. A low HRV, on the other hand, often signals stress, fatigue, illness, or that your body is under strain and stuck in fight or flight mode. This is why devices like Whoop and Oura lean so heavily on HRV. It's a genuine window into the balance of your nervous system, and into how recovered, or how stressed, you really are. The science behind it is real. So how do we get from HRV to that tidy morning readiness score? The devices blend several signals together, your HRV, your resting heart rate, how much and how well you slept, and your body temperature, and distill them into a single number, readiness or recovery. The pitch is appealing, a daily verdict on whether your body is primed to train hard or needs a rest day. And there's real substance here, those underlying inputs genuinely reflect your physiological state. But keep 2 things in mind. First, collapsing all of that into one score is a simplification, and the algorithms are proprietary black boxes. Second, and this is crucial, HRV is intensely individual. A high number for you might be low for someone else, so comparing your HRV to a friend's is meaningless. What matters is your own baseline and your own trend over time. Used that way, watching your personal pattern, a recovery score can be a genuinely helpful nudge. So how do you use all this without falling down a rabbit hole? The healthiest approach is to treat these metrics as gentle guidance layered on top of your own judgment, not as commands. If your recovery score is low, your HRV is down, and you also feel tired and run down, that's a strong, aligned signal to take it easy, and that's genuinely valuable information that can help prevent burnout and overtraining. But if the number says you're unrecovered yet you feel great, trust your body too. The danger, just like with sleep scores, is letting a metric dictate your entire day or become one more thing to stress about, which is self-defeating, since stress lowers HRV in the first place. So use these numbers as one useful input among several, keep your eye on your personal trends rather than absolute values, and let how you actually feel remain the final word. This is educational, not medical advice.